Hello, this is Adam Stewart from stewartmedicine.com. I'm here today to show you a quick tool that we use in our EMR that people seem to like. And it's actually one that the staff use when they are ushering and prepping patients with the vitals and visit preparation stuff. So this is a fake patient chart, and I'm just going to collapse down the chart and demographics to give us more room. But I want to draw your attention to this toolbar here. And this toolbar is not typically visible in the doctor's or nurse practitioner's views. It's a toolbar that is only visible and assigned to our staff. And each staff member actually has their own customized toolbar with different buttons to reflect the work that they do in their daily workflows. But everyone has this visit prep button. And what happens is when you click that, it enters an encounter assistant that has fill in the blanks for the common vitals to start. Now, the good thing about an encounter assistant, as you might know, is that if you don't enter something like a temperature or an oxygen, then it won't actually stamp anything into the note, the final note for that when it's clicked finished. So you only are entering in what's needed. So, for example, if the staff, type of blood pressure of 135/88, they can also designate whether or not that was a BP true or not, height, weight, things like that, 90 kilograms. And so that now the staff know with different types of visits, cough, cold types of symptoms generally gets a temperature, whereas, they don't need to do that for every visit. Then you've got routine types of visits. So here's some standard types of visits. So diabetic visit. So if the patient was there for a diabetic visit, the staff would click that, and you'll notice that it unhides a hidden field that asks for additional relevant information for that type of visit: waist circumference, whether or not their eye exam is due, whether or not their feet are due, and stamping in the current medications mainly for documentation purposes to meet the KO30 and QO40 billing requirements. Or, for example, if it was a well child visit, they'd be checking the head circumference as well, checking off what type of visit. And in the background, you can actually program these things to stamp in the relevant stamp for that corresponding visit. Things like pap smears, last normal menstrual period, whether they're postmenopausal, having a quick button that they can insert the lab requisition for that. Things like driver's physicals, asking for the vision checks, things like that, and the urine dip information. Pre-ops, the reason for the surgery, surgeon, although we're doing less and less of those these days, obviously. But you can see that so those are the routine types of things. Then we've also got this coded some of the common visit types, or visit reasons, whether maybe a cough, cold for acute concerns, or maybe it's a chronic follow-up visit. So there's the same types of visits over here. They could be there for both or multiple reasons, for example. And then over here, or down here, there are boxes, free text boxes, where the staff can fill in whatever relevant information, or maybe just something, some other information. So then what happens is the staff can click finish, and that encounter assistant collapses, but we're left with a bit of just the relevant information. The vitals are all stamped in. The reason, as we saw above, are checked off, and some of the extra information. One little note you'll see too is we've coded these with, say, URTI 460. And that has some benefits later on if you're trying to search your charts for different reasons that patients might have come in, like the number of patients who came in for cough, cold. It's standardized numbers so you can draw searches for progress notes containing 460, for example, or 785 for chest pain, et cetera, et cetera. The other thing you can do, which is getting really advanced, is that you can actually build toolbars off of that are triggered by these numbers in your chart note today. For example, if you had a URTI toolbar, you could have it disappear most of your days, but only show up today if 460 appeared in today's visit note. Now that's not showing up here. But it's just an example that would that you could be forward thinking and think about how to really use your EMR in an advanced way. So hope you found that useful. Thank you for watching.